mean?
All right. Go ahead and get started. It looks like we've got some background noise. If we can have our panelists mute until the introduction, that would be great. Okay. Good afternoon, everybody, and thank you so much for joining the Walk Cares Fund team and our guest panel for a webinar on caring for stroke survivors. I'm your host, Kristen Mackey. I'm the Community Relations and Outreach Program Manager for Walk Cares. I would like to go around to our panel now and have each person introduce themselves briefly. And we will start, Heidi, with you.
Thank you. I'm Heidi Stevens, and I am representing the American Heart Association today. I am a certified emergency nurse, and my background is in emergency nursing and nursing leadership.
Thank you. And Kelsey and Sarah, we'll go to you next.
Hi there. I'm Kelsey. And my name is Sarah Turnbaugh. I'm the nurse navigator for the Comprehensive Stroke Center at Harborview.
Thank you. And Gurpreet.
Hi, this is Gurpreet Sander here. I'm the Heart Disease Stroke Diabetes Program Prevention Manager and representing Washington State Department of Health here.
Thank you. And Janice.
Hi, my name is Janice Tadeo. I am here participating in the webinar as a panelist as a stroke survivor and providing my perspective as such, and happy to be here.
Great, thank you so much. All right, so we are gonna get started in just a minute with some remarks from our panel members, and then we will share an overview of the Walk Cares Fund, and then we will have an opportunity at the end for audience Q&A. You're welcome at any time to go ahead and start answering your questions using the Q&A button as they come up for our panel to answer later in the webinar. And slides in the recording will be posted on our website at walkcaresfund.wa.gov/webinars later today. And let's start by talking about, in this webinar, when we're talking about long-term care or caregiving, what we mean by that. So long-term care is help with activities of daily living, like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care, like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill, or had an event, sudden event like a stroke. And a lot of people don't realize how many different services and supports are included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, many people with long-term care needs can stay in their own homes as long as they have the right support in place. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds. And those are all common care activities. In fact, the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. And before we launch into our panelist remarks, I am going to go ahead and start a quick poll to help us get an idea of who we have in the audience here today. If you can take a look at those 3 questions and submit your answers, that would be great. I'll give folks just a minute to fill that out. All right. I am going to go ahead and end the poll and share the results. So it looks like we've got a lot of folks who have provided unpaid care to a family member or a loved one in the past or are doing so right now. And a lot of folks who work in long-term care or who know a lot about long-term care and caregiving. And then we've got about 20% of folks are not very familiar with long-term care. So hopefully this overview of WalkCares will be helpful for you. Then a lot of people who are somewhat familiar with strokes and related resources. And again, a lot of people who are somewhat familiar with WalkCares. So we hope the information that we have to share with you all today will be helpful for you. And with that, I am going to go ahead and hand it over to Heidi.
Thank you. As I mentioned before, I am a certified emergency nurse and my background is primarily in emergency nursing. And so as one can imagine, being an ER nurse gave me a front row seat into the devastating effects of stroke, both on the stroke patient and their family members and caregivers. So today I will be reviewing stroke fundamentals and the statistics of stroke in our state. It is my hope that you will leave today with a better understanding of what a stroke is, as well as how to detect a stroke. Let's start with the basics. What is a stroke? In order to explain a stroke, I ask that you endure just a little bit of anatomy and physiology. Like all parts of the body, the brain needs oxygen, which it gets from the bloodstream. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of that oxygen, they become damaged and can create devastating, wide-ranging symptoms, including death. So strokes are put into two different categories depending on the problem within the blood vessel that is supplying the brain. They can either be a blockage or a bleed. If we can go to the next slide. Thank you. So the differentiation between the blockage or the bleed is very important, and this is diagnosed within the emergency department, and it does dictate the type of treatment that a patient receives while in the hospital. So the types of strokes, let's go into that in a little more depth and discuss the different types of strokes. So as I mentioned previously, they're put into two different categories, a blockage or a bleed. A blockage is also known as an ischemic stroke, and these make up the vast majority of strokes that we see nationally and here within Washington state. Close to 90% of strokes are ischemic strokes. Blockages are commonly caused by buildups of fatty materials within the blood vessels. The buildup can lead to a clot, which then blocks blood supply. A bleed, on the other hand, is known as a hemorrhagic stroke. And this occurs when a weakened blood vessel bursts and ruptures, and essentially the blood then leaks into the brain. Sometimes stroke symptoms can completely resolve on their own, and this is what we call a transient ischemic attack, or TIA, also known as a mini stroke. Mini strokes or TIAs are often a warning sign that a person is at a much greater risk for suffering from a full-blown stroke. And so this is why it's imperative that even if stroke symptoms have resolved, that a person seeks emergent medical care. Impact of stroke in Washington state. So the stroke death rate is stable within the past decade here in Washington state, as in it's not increasing. However, stroke does remain one of the leading causes of death and disability. 2.9% of adults in Washington suffered a stroke in 2022, with 21.8 per 10,000 people being hospitalized with a diagnosis of stroke, and 42.4 per 100,000 people with stroke as the underlying cause of death. Similar to national patterns, in Washington state, stroke death rates drastically increase with age, though it is important to know that stroke can occur at any age. So let's discuss those wide-ranging symptoms of stroke that I mentioned before, and we can quickly go over the FAST acronym. It's an incredibly important and helpful tool for potentially recognizing a stroke. Sometimes these disabling symptoms of a stroke can be reversed if treatment is started early. So this is why it is imperative to get help fast. F-A-S-T. F stands for face. Is the person's face drooping on one side? Can the person smile? Is their smile even? Arms, is there numbness or tingling or weakness in one arm or the other? When they lift their arms up like a zombie, does one droop down to its side? S is for speech. Is their speech slurred? Does their speech sound atypical to you, abnormal to you if you know the person? If you don't, are you able to understand what they're saying? And finally, T is for time. If you notice any of these signs or any acute changes to vision, loss of balance, acute confusion or memory changes, it is time to call 911. The faster a stroke is treated, the more likely a patient is to recover. In the emergency department, we write it down to the minute from when a person's stroke symptoms first occurred. Finally, I want to close with several resources that are available to stroke survivors, family members, and caregivers. I want to ensure that I express my empathy that this is an incredibly challenging journey to be on. Support groups are key to recovering from a stroke, as they can connect you with others who have similar stories. It's where you'll find new friends and hope on this post-stroke journey. So please know that there are resources available to you and to your loved ones.
All right, thank you, Heidi.
Thank you.
And next we will go to Kelsey and Sarah. And I'm going to go ahead and stop our screen share so that you can share your screen.
Everybody's set. Okay. Okay. I'm hoping yes. So just to build a bit on what Heidi was saying, time is up yes. And there are two main times, both of
Kelsey, we're having a little bit of trouble hearing you. If you can maybe move closer to your speaker.
pardon the close up. Is that any better?
It's a little better, yeah.
Okay. I will try to speak a bit then. So to build a little bit on what Heidi was sharing with us, there are two kinds of strokes, both bleeding and occult stroke, and calling 911 is of utmost importance. Please do not drive yourselves. Call 911 so they can do evaluation, and also communicate with the hospital, the local hospital, to let them know that you're on your way, because the first thing we got to do is get imaging. Usually a CAT scan to rule out blood, followed by other diagnostics after that, because then there are two time-sensitive interventions that can happen. And you just want to give yourself every opportunity for those interventions if you're eligible. And the only good way to know that is with imaging. Stroke recovery is a journey, and we want to reduce the risk of disability, death, as much as possible. It can take several months and sometimes longer to recover from a stroke. Many people who experience a stroke can have emotional, cognitive changes, outside of physical impairment. So having that good support is so important and very helpful. Here at our institution, there are a couple other letters that have been added to the FAST acronym, including the B and the E. So other things to monitor for are B is for balance, any changes in how you move or coordinate your movements. And E is for eyes, any kind of vision loss or a field cut in one or both eyes. Even if that's the only symptom, it's still a medical emergency. It is evaluated with imaging and diagnostics and potential intervention. So again, I'm gonna give yourself every opportunity for an intervention if you're eligible, and we got to get that in first and foremost.
Again, my name is Sarah, and I'm the nurse navigator at Harborview Medical Center. I work closely with Kelsey. My role really starts when patients are being discharged from Harborview after having had a stroke, and they're going to be going home. We do have patients who are discharged to an inpatient rehab and to a skilled nursing facility. What we found is that we wanted to target patients who are going home, since those are the people, our population, who may have less hands in the pot as far as navigating the recovery and the follow-up after having had a stroke. So my role as the navigator is to connect with patients just prior to discharge home, make sure they know their resources for contacting me directly, as well as other members of the stroke team and medical team who cared for them while they were here. I then do a follow-up phone call within 7 days of discharge to ensure they've received the medications they were prescribed. A lot of times patients are discharged with new medications, a different regimen, a different dosage for medications they may have been on. So I ensure that they're adhering and understanding those medications. We also want to ensure that patients have a follow-up with their primary provider. Risk factors for stroke include high blood pressure, diabetes, obesity. And so we really work in conjunction with the primary provider team to manage those more chronic conditions and risk factors for stroke, while also educating the patient for secondary stroke prevention. The other thing I do in my role is I ensure that patients, as part of their recovery, they may have referrals to physical, occupational, and speech therapy, and sometimes home health. So I ensure the best I can to make sure that they have gotten connected with those agencies locally, and communicate with our team here at Harborview for patients that are going to be following up with us in regard to those referrals, and kind of close the gap and help navigate as we need to for our patients who are going to be coming back to the stroke center. The other thing, just wanted to kind of reiterate the resources that we have for patients who are recovering from a stroke. We have the Stroke Support Club, which is what the QR code is on your screen. And then we also work with, there are some other support clubs, yes, who I think Heidi had on her slides as well. So we just, ensure that patients are aware of all the resources they have as they recover from stroke.
A lot of evaluations happen while in the hospital that help to determine what are anticipated upon.
Kelsey, we're having some trouble hearing you again. I'm not sure why. Maybe if we can get, I don't know if it's like one side of the microphone is working, because we were able to.
Here, sorry, okay.
Yeah,
Maybe it's my angle. Is that any better?
that is so much better. Thank you.
Okay. Must be the directness of the camera. But what I was just wanting to additionally add before passing off is that a lot of different multidisciplinary teams are evaluating patients while in the hospital to determine those needs for outpatient support and care and follow-up appointments. So the inpatient in-hospital experience is very robust. There's a lot of different members evaluating the patients and that help create a plan of care. for that discharge process and support when leaving the hospital. So thank you.
Thank you both. All right. Next, we are going to go to Gurpreet to talk about stroke prevention. I'm just pulling up your slides real quick. All right. You can take it away.
Thank you so much. Hi. So yeah, I mean, considering when Haiti shared the statistics of stroke in the state of Washington with us, it is one of the biggest issues and also one of the greatest cause among that leads to mortality and disablement. So I guess prevention starts from home. So I would like to share some preventive measures and that can be followed to be able to not fall in the crutches of stroke. So if you can please move on to the next slide. There is a program that runs by DOH, which is called as Great Eight. It focuses on the 8 main things towards prevention of stroke. The number first comes as active. Can we move on to the next slide, please? So being active. And being active does not only bring about bone health growth, organ movement, cardiovascular health, gets your heart beating and gets your blood flow moving, but also has other activities. It cannot lead to frailty. It may help prevent stroke conditions and even the risk factors that lead to stroke. Maybe please move on to the next slide, please. As mentioned here, activity, any kind of physical activity, be it gym app programs or be it walking or being regular, they could lead up to reduction in blood pressures, cholesterol levels. The insulin levels could be made into control, and it could make up an increased oxygen uptake for the organs, for the brain and the heart, and ultimately lead to a better bone health, a better balance, and fewer falls, which could lead to less brain injuries and further conditions that relate to stroke. Activity can also help maintain body weight and also work on improving depression or anxiety. And when done with others, if done in groups, be it small or big, it could also cover up the isolation part and help you interact with others, which is one of the causes behind patients that take up symptoms of stroke. Will you please go on to the next slide, please? The next one is eating well. Along with exercising and being physically active, it is very important to eat a nutritious and a balanced diet. Next slide, please. So, when it comes to having a balanced diet and a nutritious diet, it comes up with certain things that are required in greater proportions and certain things that should be avoided in the diet. So, for example, we need a lot of protein in our diet. We need a lot of vitamin D and other minerals that come from fruits, vegetables, and colored fruits and vegetables. So we can avoid processed food, we can avoid frozen food or already cooked meals, and also avoiding high sodium diet. Also trying to have a balanced, a colorful plate, which includes grains for your carbohydrates, which includes fruits and vegetables for your minerals and vitamins, and also includes a portion of lean meat for your protein. And avoiding a diet that is rich in sugar, for example, the sugared beverages, and also the ones that are processed, which more amount of sugar in them can help decrease the inflammation within the body and also help improve your blood pressure symptoms and also help improve the oxygen intake by the organs. Next slide, please. The other one is practicing wellness. With practicing wellness, we mean to focus on the mental well being and the physical well being. Now, as discussed above in tip 1, which was activity that takes care of your physical well being, but along with that, it's very important to be mindful of mental well being. Next slide, please. So, reducing stress by changing the expectations and living in the present and recognizing of what you have control over and what are the things that you cannot control. Stressing on things that you do not have control over could lead to less oxygen intake by the brain and the heart, and also could lead to further leading down to depression, which could lead to substance abuse and further lead down to stroke. Also, it's important to know what your stress triggers are, because once you're aware of your stress triggers, you can help manage them. Give yourself a gift, pamper yourself with the gift of healthy lifestyle. And that comes with eating a proper diet, being physically active, doing meditation, or doing things that could help you stay calm, and be stress free. And also reduce stress by practicing gratitude and joy. And it could be done in simple exercises by staying in present and being happy. Also, spending time in developing supportive and nurturing relationships, be it in person or be it at work, that are the biggest factors that could help manage stress and avoid any kind of substance abuse that comes into play or role play as a result of depression or anxiety that comes because of stress. Next slide, please. The next one is keeping your blood pressure in control. If you have your blood pressure in control and you know your limits, some people, it differs from body to body. Some people do have a little higher than usual blood pressure, and also knowing that 120 by 80 is not something that everyone will have. Some people have their body blood pressure as low and some people have it higher, but knowing how your body accommodates to those changes or how your body accommodates day to day to your pressure helps increase the oxygen intake and maintain a proper blood circulation within your body. Next slide, please. Knowing your blood pressure categories, we have a normal blood pressure category, which should be that your systolic, the upper level, should be lower than 120, and the diastolic pressure be lower than 80. If the blood pressure is higher between more than 130 and up, then it would be considered as elevated. Similarly, for the bottom portion as well. Once you enter into the hypertension, which is stage 1, when your blood pressure is actually higher as compared to the normal levels which your body can support, or the conditions when you need to be mindful and also be going to get a checkup with your physician or your pharmacist or the local nurses so that you could have your blood pressure under control. Next slide, please. The other one very important is, along with having your blood pressure in control, it's important to have your blood sugar levels under control. Next slide. Knowing your blood sugar levels and knowing the average blood sugar levels for a proposed body weight, it's important, and also plays a role towards maintaining a good oxygen intake and blood circulation, and also preventing stroke or any kind of cardiovascular problems. Next slide. The further down is knowing your cholesterol levels, because as Heidi was discussing about what are the signs and how does stroke develop, you see that there are clots that develop within the arteries or the veins of our brain. And that happens because of plaque formation or plaque deposition within our arteries. And plaque deposition happens because of increased cholesterol levels. Here we need to be mindful of that there are two types of cholesterols, high density and low density. low density cholesterols are the ones that need to be lower, and high density ones are the ones that are good type of cholesterols. Next slide, please. And as Heidi was discussing about the statistics here, we have that heart disease and stroke are the #1 causes of death in the state of Washington. And the risk factors like having increased blood sugar levels, having increased blood pressure, having increased cholesterol levels are all the risk factors that contribute towards these conditions. And in order not to come up to this stage, when they come up to a fertility rate, it's important to follow the preventive measures. Next slide, please. The number 7 is steer clear of smoking or vaping. And there are tons of resources that are available that you could have access to get help or support if you want to quit smoking. Next slide, please. Here are a few of the resources. There are some self-help materials, and these are all clickable links that can be visited and gained information about how and where to seek help from if you want to quit. Next help, please. In the state of Washington, there was an emergency cardiac and stroke system. It was basically based on the same system that works under trauma. So the main goal of this system was to reduce the time that it takes from the patient when the symptoms are onset to the time when the patient receives help. And the main goal was to reduce the time limit under 120 minutes. And this was important. Why was this recognized? It was recognized because when a patient comes up with symptoms, the patient needs to go to the right place. The patient might be experiencing cardiovascular symptoms or high blood sugar level symptoms or stroke symptoms. If the person is brought to the right place at the right time, then the patient's disability and life can be saved. So this program here was mainly introduced to save lives and reduce disability. And that too, getting the main help under 120 minutes. So if you see the patient, as can be seen in the picture here, the patient, when he or she comes up with pain or symptoms onset, the first point is to call 911 for help. The second step, immediate action, is within a minute of the call, receiving EMS help. And then within 15 minutes, being sent out to the right spot for help, and then receiving door-to-door care within 60 to 90 minutes, because the initial 90 minutes within the onset of symptoms of stroke are very critical. So it's important to get that help within that time frame. Next slide, please. So as I just said, the main reason why this program was needed was because too many people were being either disabled or dying because of the main cause that they did not get the treatment on time. So the only solution was adopting a standard procedure for emergency medical services to assess and triage the cardiac and stroke patients, identify the hospitals that can treat cardiac and stroke patients, and meet criteria to participate in the ECS, which is Emergency Cardiac and Stroke System, and also require quality improvement activities for participating hospitals. And further, expanding the scope of EMS and trauma regional quality assurance programs to include cardiac and stroke cases. And that was all under the umbrella of Emergency Cardiac and Stroke Care Program. Next slide, please. And for more information, there are website pages that we can acquire on what categories are the hospitals categorized on when providing emergency cardiac and stroke system care, what areas are there, how to identify yourself, and how to receive care. Next slide, please. Always remember, it's never too late. Even if you are a stroke survivor or have someone knowing with cardiovascular issues that could have the potential to lead down to stroke, it's never too late. We're all in this together, and there are lots of resources that can be accessed to seek support. Next slide. The main motto is to begin today. Even small changes among any of those great 8, identifying the changes that need to be done, smaller changes could lead to bigger steps after, because it does not come with perfection in the beginning. Start on with small achievable steps right now, and definitely you can slowly progress towards on the prevention pathway. Next slide, please. As I mentioned again, you can seek help from your family members, from caregivers, from friends, or support groups, and never hesitate to ask for help. There is no age limit to ask for help. There is no restriction to ask for help. We are all in this together to support the community. Next slide. Any questions, more than welcomed, and thank you so much.
Right, we are actually gonna move to our next panelist, and we'll have Q&A in just a few minutes at the end of the presentations. So next, we are going to go to Janice.
Hello, everybody. I don't have a slide presentation, but I am going to go ahead and share my story with my experience with being a stroke survivor, and again, my experiences with my need for long-term care. So again, my name is Janice Tadeo. Back in April of 2020, unfortunately, I suffered a hemorrhagic stroke, which put me in the hospital for about 2 weeks. And then I spent another about 2, maybe a little bit more than 2 weeks in an inpatient rehabilitation center. During that time, during my time in the hospital and in inpatient rehab, I found myself having to relearn how to do things like how to walk. I had to learn how to swallow drinks, and even eating my food. So I spent a lot of time with speech therapists, with learning how to do things like the eating and the drinking. I also needed assistance with even talking, because that, unfortunately, the stroke affected my ability to speak. Mobility was also something that I had to kind of relearn during my time in the hospital and in inpatient rehab. I couldn't walk. Well, I could walk, but I need a lot of assistance. Even, lifting my hands, especially the left side, with the weakness that I experienced with this from having the stroke. I had to learn how to use the my left hand, with things like picking things up, and, with eating, how to use my left side to help with eating, and all of those things. So after being discharged from the hospital and inpatient rehab, I was able to finally go home. However, I couldn't go back to my home. I actually had to move in with my family, specifically my parents, because I found myself unable to live on my own. I was a single mom. I had my son at the time. It was just the two of us. And I found myself needing additional assistance, and found myself at home with my parents, with my mom, especially being kind of like my primary caregiver. And then, of course, with the help of my dad and my siblings, and of course, my son. So there was a lot of help, again, with things like walking, meal preps, because I couldn't cook for myself or eat. I needed help with showering, even things like using the toilet. I needed assistance with dressing myself, getting help with transportation to multiple appointments. And of course, making sure I took my medications. I was also considered a fall risk. So, having safety measures placed around the house to kind of mitigate the chances of me falling. And so, I found myself really relying on family members and caregivers with daily activities and tasks. Of course, fast forward to now in 2024, I have recovered to the point where I don't need nearly as much assistance with daily activities, but I do still require some assistance. My mobility, although it's improved, I still need assistance with walking, and then meal preps. Sometimes I'm needing help with making myself meals, and even transportation. I still do rely on family members to get me to medical appointments. So that's kind of my experience in a nutshell. Really wanting to highlight that caregivers really do play an important part in a person's recovery after having a stroke, and really not just kind of the physical aspect of recovery, but also mental health. You go through a lot after experiencing something like that, and just to kind of have everyone keep in mind, I was only 39 when the stroke happened, and so kind of being on the younger, being a little younger and experiencing that, it took a really big toll on my mental health. And so really relying on my family members to help with dealing with that, going from somebody who was fairly active and super independent to kind of losing that independence it's a big deal. And so thankfully for me, though, I had a huge support system. And it's just a good reminder really to be thankful for the folks that you have in your life, especially when you find yourselves relying on them the way I did. So that's my story. And again, in a nutshell, and there's more and a lot more detail, but for the sake of time, I just wanted to share that with everyone. And happy to take any questions when we get to that point. Thank you.
Thank you so much, Janice. We really appreciate sharing that. Okay, I am going to go ahead and share my screen again. Just one moment. So, like Janice, stroke survivors often need long-term care during the recovery period, and that could mean anything from a few hours of help at home each day to care in a facility, and needs can change over the course of recovery. And as Janice also mentioned, family members often take on a role informally as a caregiver, which can be really rewarding, but it can also be demanding and stressful. So let's talk a little bit about the Walk Cares Fund and how the program could help stroke survivors and their families and loved ones in the future. So Walk Cares is a universal long-term care program in Washington State. It's an earned benefit, which means you contribute for a certain number of years in order to qualify for benefits. And it is entirely self-funded from worker contributions. Workers contribute 0.58% of each paycheck to Walk Cares. And you can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to Walk Cares while you're working. Contributions stop when you retire or if you become unemployed. And with Walk Cares, everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays or deductibles, and you don't need to pay upfront for services and file claims. Instead, we connect you with contracted providers for the services that you want and pay those providers directly. Contributions to the program began in July 2023, and benefits will become available in 2026. This is what those contributions can look like over the course of a career. The typical worker's income is just about at the level in green here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. Almost all Washington workers contribute to Walk Cares. So to determine whether someone counts as a Washington worker, we look at whether their work is localized in Washington. And that can be complicated, but because we use the same definition as the state's paid family and medical leave program, that gives us a rule to work from, which is that workers who are included in paid leave will also be included in Walk Cares unless they have an approved Walk Cares exemption from the Employment Security Department. And if you're not sure whether you participate in paid leave and Walk Cares, you can check your pay stub or you can ask your employer for more information. Workers whose work is not localized in Washington are automatically not included in paid leave or Walk Cares. Federal employees are also automatically not included. Employees of tribes are only included if the tribe has opted in, and self-employed people are also similarly only included if they opt in. There are some other workers who can get an exemption from Walk Cares, which they must apply to the Employment Security Department to get. And there's some of these groups that are able to apply for exemptions here on your screen. Just for the sake of time, I'm not going to go through these in detail, but if you're interested in more information, you can visit walkcaresfund.wa.gov/exemptions. And if you are self-employed, as mentioned, you can also choose to opt into the Walk Cares Fund and protect yourself with the same affordable benefits that are available to other Washington workers. There's some more information here. Again, I'm not going to go into detail, but you can learn more on our website at walkcaresfund.wa.gov/opt-in. So everyone who is contributing to Walk Cares more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the $36,500 benefit. There are 3 pathways that you can use to meet the contribution requirement. The first is lifetime access, and this is the pathway that we expect the majority of Washington workers will use to qualify for benefits. To use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. This pathway earns you access to the full benefit amount, which is that $36,500, which is adjusted for inflation. The next pathway is early access. So this is for workers who have not yet been able to earn lifetime access, but have a care need while they're working or soon after leaving work. So to qualify for this pathway, you need to have contributed for at least 3 of the past 6 years at the time that you apply for benefits. And this pathway also earns you access to the full benefit amount of $36,500. And then finally, we have a special pathway just for people who are near retirement. So if you were born before 1968 and are therefore near retirement as the program begins and unlikely to be able to qualify for the 10 years pathway, you earn 10% of the full benefit amount for each year that you work. So for example, if you work and contribute for 500 hours or more per year for 3 years, you would earn 30% of the benefit amount, or just under $11,000, which again is adjusted for inflation. Near retirees have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. And they are also able to qualify through one of the other pathways if they meet those requirements. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to what you can think of as a $36,500 budget for services and supports. That is a lifetime benefit amount, and it will increase over in time with inflation. So with Walk Cares, workers get the flexibility to choose the services and supports that meet their needs. So that could mean in-home or residential care, but it could also include home modifications to make their home safer and assistive technology for things like medication reminders or fall detection. Walk Cares is really designed to help people get care in their own homes as much as possible, especially as they age. And Walk Cares also has many options that are designed to provide support for family caregivers. So with Walk Cares, you can choose someone who would be otherwise caring for you on an unpaid basis to get training and be paid, including your spouse. And Walk Cares can help lessen the impact on family caregivers by either paying them for their time or making sure that they can get other support services. We get asked a lot about how far the benefit will go. So while it won't cover 100% of care for everyone, it really depends on what your care needs are. It would cover the amount of in-home care that the average Medicaid long-term care client in the state uses for roughly a year. About a third of people need care for a year or less. And for those people, Walk Cares may be able to cover all the care that they need. And for others, Walk Cares provides the family with immediate relief and time to plan for future care costs, especially in scenarios where there is a sudden event like a stroke, maybe a younger person who doesn't have private long-term care insurance, maybe doesn't have the savings to be able to get the long-term care that they need. So these are a few examples of how someone might use their benefit. You could pay a family member to care for you for about 10 hours per week for 2 years and get care supplies for a total of about $33,500. Or you could choose services to help you stay safely in your own home. You could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve your home's accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury or illness could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. We also have some great news from this legislative session. The legislature passed a new law allowing people to take their Walk Cares benefit with them if they move out of state. And to become an out-of-state participant, workers must have contributed to Walk Cares for at least 3 years and must opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years, and the state will create a process for them to report their earnings and pay premiums. Benefits will then become available for out-of-state participants starting in July 2030. And if you want to learn more about benefits, out-of-state coverage, and find out when we have updates or find more details, we recommend signing up for our mailing list at walkcaresfund.wa.gov. And with that, we're going to go ahead and take some Q&A. I see we have one question already up, and if you have additional questions, you can go ahead and drop them in using the Q&A button that's on your screen. So the first question is from someone who says, my wife has Bell's palsy and chronic migraines, and when she has a migraine, her face droops. We assume because of the Bell's palsy, and rarely she stutters, and is asking whether that's something that should be considered a stroke or just part of that existing condition. So I think if we could have one of the panelists maybe talk a little bit more about those signs of stroke and what happens when some of those signs might be something that someone's already experiencing.
I think I could probably share some information about that. So typically for folks who have migraine history, what we'll say is that their migraines have a typical pattern, and the stroke symptoms are atypical to their migraine pattern. So For example, if somebody's migraine is always in the same spot, same intensity, same trigger, it's fairly predictable. Maybe they have an aura before it. That is less concerning. If it completely changes and is something new or different, that is cause for concern. That is a time to call 911. That also being said, if there's a new symptom with the associated Bell's palsy, or an added symptom, something different, that would be reasonable enough to get checked out and should be checked out. I always encourage patients I meet to listen to your body, listen to your senses. If you know yourself better than anybody, if something feels off and you can't quite put your finger on it, get checked out. We don't have x-ray vision, so we got to get that brain imaging. Nobody's going to fault you for getting that evaluation. So it's always better to be safe than sorry, but the general kind of rule of thumb is that migraines have a pattern and anything new or different is cause for concern. Hopefully that helps answer the question.
Great, thank you so much. All right, that brings us to the end of the questions that we have in the Q&A, and we are also just about at time. So to close us out, thank you all so much for joining us today. You can find the webinar materials from this webinar again. The slides and the recording will both be posted on our website at wacaresfund.wa.gov/webinars. If you have additional questions, you can always contact us by email at the link on your screen or by phone, and we would be happy to talk with you more. And then finally, I want to invite you all to join us next month. In June, our webinar will be another WaCares Conversations panel on brain health. So we look forward to seeing you all then. Thank you again for joining us today. We really appreciate your time.